Hi, my name is Christy St. Louis, and it's June 29th, 2021, and I'm doing the Unit 2 case connections. So for the patient, for case number 2, she was diagnosed, of course, with McArdle disease since she has a deficiency of muscle glycogen phosphorylase 9. Okay. So she had asked, can you explain how muscle glycogen is used normally during exercise? And the answer to that is that skeletal muscle tissue is made of cells that transform chemical energy into physical and mechanical energy, right, for work through ATP. And glycogenesis is the main substrate used during exercise. So glycogen is the storage form of carbohydrates for humans, right? So muscle glycogen is broken down, and this is what's freeing up glucose molecules to be oxidized to produce ATP. So ATP is the energy source molecule that is required for your muscles to contract and do what they do. So in muscle glycogenesis, glycogen phosphorylase is activated by calcium. And when your muscles are contracted during exercise, that calcium is going to activate phosphorylase, and that's what's going to start breaking down glycogen. AMP is also produced during this stage, and when ATP is being broken down, this is going to trigger more phosphorylase to make glucose 1-phosphate. And that's the precursor to make glucose 6-phosphate. And that's used for glycolysis to produce energy for your muscle contractions. So this production of energy is like a rapid source of energy for when you do strenuous activity and when you're using your muscles, okay? But it's used in a limited amount. She also asked, I like to take long walks. Will I still be able to do that with my friends? And the answer to that is she does have McArdle disease, which, of course, that means she has a deficiency in muscle glycogen phosphorylase 9. It's a mutation of the PYGM gene. So that's going to affect your muscles and their ability to utilize muscle glycogen phosphorylase, right? And that's what we utilize to break down glycogen for energy. So remember that your muscles need a constant supply of glucose in order to work well. So if you have the McArdle disease, your muscles can't break down the stored version glycogen very well. It causes symptoms like a lot of muscle cramps, weakness, fatigue, and that mostly happens during physical activity. So if you want, you can do a balanced amount of non-intense exercise. A lot of doctors do recommend patients with McArdle to do non-intense exercise since they can continue to do that. And that'll also be beneficial for her muscles to just keep their same, density, okay? And so that they don't decrease in strength over time. So walking gently wouldn't be hard, but you may have trouble with strenuous activity. I wouldn't recommend that patient to do strenuous activity for longer than a couple minutes. And then there's also something called the second wind phenomena, where you might have a boost in energy after about 10 minutes of rest. So because you've kind of replenished your source of glucose and fatty acid sources, you may notice that after taking a little break for about 10 some minutes, you'll get a little boost again to continue exercising. Also, some doctors do recommend patients with McArdle to maybe drink or eat something with sucrose to give them a boost in their blood glucose sugar levels beforehand, but that's kind of debated, okay? Next she asked, will I need to get up at night to eat to maintain my blood glucose levels? And the answer is no. Although glycogen is involved in regulating your blood sugar during the night or during fasting, McArdle's disease does not affect your blood glucose levels during period of fasting that much. It's mostly going to affect you when you're trying to do intense muscle activity. But you may want to refer to a doctor. A doctor should give you some options in terms of what to eat. Like a diet rich in carbohydrates will be good, because rich foods or foods that give you a rich supply of glucose will help your heart to stay healthy. And the more your heart stays healthy, the more your body the more your body will be able to take in a good supply of oxygen when you're doing things, okay? Then she also asked, do I need to worry about producing excessive lactate during intense anaerobic exercise? And the answer is, well, anaerobic exercise doesn't use oxygen, okay? So after intense exercise, lactate is built up and it's produced from anaerobic glycolysis or glycolysis. The end product of this is pyruvate, which is turned into lactate. So after exercise, the lactate diffuses from your muscle into the blood and also into your liver, which it's going to convert that into glucose again when you need it, okay? So when you overwork your muscles, you might use anaerobic, respiration, which doesn't use oxygen, which produces extra lactate. But since you have McArdle's, I wouldn't even recommend you to do intense anaerobic exercise. It would be extremely hard for you to do it anyway. And your levels of lactate will probably be very low compared to normal individuals, since your ability to follow that pathway for anaerobic exercise is disturbed. So patients with McArdle are known for having little to no lactate production during exercise because of this. So low intensity exercise is best for patients of this disease because it doesn't rely on anaerobic respiration, okay? Low intense exercise, which is aerobic, is recommended for patients of McArdle's, okay, as opposed to intense anaerobic activity. So now the other case that I did was case 4, okay. So you have this 2-month-old baby, and the baby has these symptoms. So from the test results and the symptoms that the 2-month-old baby had from breastfeeding, this baby probably has glycogen storage disease, okay, which is an inability to use glycogen. The reason is because the baby is, well, first of all, glucose is the sugar that our body uses to fuel our cells. And when we use enough glucose, the rest of it is stored as glycogen in your liver and also in your skeletal muscles, okay? So the baby is missing the enzymes that are needed to store the glycogen and also break it down, okay? Not store it, but definitely in terms of breaking it down when the baby is not eating, like during periods of fasting. So there is a lack of a vital enzyme needed to convert that stored glycogen back into glucose during glycogenolysis, okay? So during the physical exam, they said that her liver was swollen, which is a big clue. This would be due to the excess of glycogen that's staying in her liver, but it's not being broken down and it's not being taken into the bloodstream. It's just building up and building up. So it's making her liver swollen, okay? And also her test results show that she suffers from hypoglycemia, which is also because her blood sugar levels are dropping because she's not being able to use that stored up glycogen in order to take that to the bloodstream to regulate her blood levels. So now she's suffering from hypoglycemia, right? And also, the epinephrine is a hormone that stimulates, glycogen breakdown. But there was no increase in glucose during the test results, okay? Because that pathway to produce the glucose is being messed up right now, okay? And in her case, the lactate is due to her inability to break down glycogen. So she can take in lactate, but she's not able to break down glycogen during fasting periods to regulate her blood sugar, okay? So she most likely has GSD, but the form that she has is probably type 1 because the type 1 affects the liver most of all, and that's also the type of GSD that's common for children her age and for most patients with GSD. It's not hereditary intolerance, hereditary fructose intolerance, because the symptoms of those are nausea and vomiting, abdominal pain, and resistance to nutrients, which she doesn't have. And it's also not galactosemia, which would be a inability to break down glucose. She doesn't have that issue. And the symptoms would be like loss of appetite for breastfeeding, poor weight gain, and even maybe jaundice. She doesn't have any of those in her test results. And lastly, it's not the glucose 6-phosphate dehydrogenase deficiency. That causes red blood cells to break down. She would have symptoms of anemia for that case, maybe even darkening of her urine, jaundice as well, or pain in her abdominal regions, and none of her test results show that or any of her symptoms. So the best case scenario would be a diagnosis of glycogen storage disease. Okay, thank you.